Hi, this is Dr. Ryan Myers, owner of the Movement Clinic and owner and founder of US Hyperbarics. The number one question I get asked by patients that come into our office, and especially the clinicians that I train around the country on how to use hyperbaric oxygen therapy in their offices, is what is the correct pressure? And it's a great question. There's lots of options out there. You'll see everything from 1.3 to 1.5, 1.75, all the way up to 3 atmospheres. And we get asked, doesn't it need to be a higher pressure for it to be effective? In fact, I've even had patients tell me that doctors have told them if it's not a certain pressure, it doesn't work. Well, guess what? That's not what the research tells us. The research, the medical literature that's coming out on US hyperbarics and has for the last 10 years tells us that pressure does not matter. We've seen the same results come from 1.3, 1.5, 1.72 and higher. The research studies are showing us that all of the pressures are beneficial, and in fact, all of them show the same amount of healing in progress. So what does that mean? It means actually any pressure is going to help you, but one of the things that patients need to understand and clinicians is the lower the pressure, the more comfortable it is. The more you're going to enjoy the experience, the more the experience is easier for you, for your kids, for whoever's getting in. So what do we use? We've chosen 1.3 atmospheres, but we also get you to 90 to 93% oxygen. And we have found with over 20,000 hours of patient experiences in the hyperbaric oxygen chamber that combination of 1.3 atmospheres and 90 to 93% oxygen produces such a high level of healing, and that patients are compliant, they're comfortable. There's very little to no pressure in their ears, and it's safe. That's the biggest thing. The higher pressure you get, the more risk there is, the more complications there can be, and it's not comfortable. You don't want to do it. I've talked to patients that have done the higher pressures. I've done the higher pressures. And the biggest thing, we have people in our area that are using these higher pressures that charge 2, 3, 4 times the amount per session than what we can charge in the lower pressure. So the number one thing is the healing outcomes are absolutely no different. If anything, they're better because you can do it more often, you have higher compliance because it's comfortable, and it is safe. Safe. In over 20,000 hours of hyperbarics, we have a 0 injury, 0 complication history here in our clinic as well as around the country that's happening every day. That's not the case in higher pressure. So when you're looking for a solution for hyperbaric oxygen therapy, don't be fooled by those that tell you if it's not a certain pressure, it does not work. It's not true. All pressures will work, but the higher the pressure, the more risks, the less safety, and you actually cannot do them as often. So again, we've chosen 1.3 with 90 to 93% oxygen because it is supported by the medical literature that produces a high outcome and the same outcome as higher pressures, and it's safe, it's comfortable, and it's easy. So you're gonna wanna do it every day, your kid's gonna wanna do it every day, and you literally can do it every day. So when you're looking for hyperbarics, check us out at the Movement Clinic. Look at US Hyperbarics if you're looking to purchase one for your home, your clinic, and let us know what we can do for you.